Dopamine, common trade name for dopamine is intropin, although it is widely available as a generic at this point. The class is a vasopressor and an inotrope. How it works in low doses, less than 5 micrograms per kilogram per minute. It increases mesenteric, which is an intestines, I should say. It increases mesenteric and renal blood flow, helps get those vital organs perfused. Medium doses, 5 to 10 range, gets beta receptor stimulation, causes the heart to beat harder, beat faster, all that good stuff. And then at the higher dosage, 10 to 20 microgram range, you get the alpha receptor stimulation, get the vasoconstriction that you might need to increase blood pressure, preload, all that good stuff. Pregnancy class is C. Indications: cardiogenic and or septic shock. Hypoperfusion is the big thing. And hypotension, bradycardia, it counteracts all that good stuff. Some contraindications: hypovolemic shock. So you want to make sure if someone is a hypovolemic shock, give them lots of fluids to correct that issue before you go into dopamine. You don't want to just jump straight to dopamine. Uncorrected tachydysrhythmias, and VFib, of course, and then pheochromocytoma, which is tumors on the adrenergic glands. Tumors on the adrenergic glands causing excessive stimulation, so it's just pushing out too much. Catecholamines there. Adverse reactions: it's very necrotic, so make sure you got a good IV before you start pushing it. Chest pain, dyspnea, dysrhythmias. It does, because it causes the heart to work harder, pump faster, all that good stuff. It will result in increased myocardial O2 demand, so make sure you're giving them plenty of oxygen. Nausea, vomiting, anxiety, headache can cause all that. And then if you go really, really high in your dosage, greater than 20 micrograms per kilogram per minute, it can cause some peripheral circulatory compromise, where those vessels in your hands, your fingers, your toes, your feet, stuff like that, are just so clamped down because of those alpha effects that it actually is cutting off blood circulation, blood flow to those periphery. So we want to watch for that and try to avoid that. Shouldn't be going above 20 micrograms unless you've got a specific doctor's orders. Some drug interactions: it's incompatible with sodium bicarb, as are most drugs, who want to use different IV sites. MAOIs, they can enhance the effects of it. If it's used with phenytoin, then it may cause hypertension, bradycardia, and seizures. So it's like a opposite reaction with it. Dosages: typical adult, 5 to 20 micrograms per kilogram per minute, IV or IO, same with the kids. Onsets 1 to 4 minutes, peak effects in 5 to 10, and then it's working as long as you've got the infusion going. As soon as you stop that infusion, then the drug stops working pretty much almost simultaneously. And that's really about it for dopamine. It's a pretty good inotrope. Use it a lot.